Everyone, my name is Ruth Kennedy, and on behalf of the Louisiana Medicaid Program, the Bureau of Health Services Financing, the Department of Health and Hospitals Office of Behavioral Health, and our 5 Bayou Health plans, welcome to the first of our 10 informational sessions that we're going to be hosting throughout the state over the next 2.5 weeks to talk about the transition of specialized behavioral health services, that is specialized mental health services and substance use treatment services, from the current contractor Magellan to our 5 Bayou Health plans, and that is going to be for services that are delivered on or after December 1st of this year. And so for those of us who count those kinds of things, that is 22 working days, including the rest of today, until that transition occurs. We have here with us the executive teams from the Office of Behavioral Health. As you know, in Louisiana, under state law, the Office of Behavioral Health within the Department of Health and Hospitals is the entity which oversees behavioral health, mental health services in the state. And so they are a partner with us in that transition, along with our Bayou Health plans. You, our providers, more than 2,000 separate providers of behavioral health, substance use treatment. You are the stakeholders, advocates who advocate on behalf of children and families receiving services. Welcome, because it truly takes all of us to do a change in improvement of this magnitude. So a little bit, let me just give you a quick preview of what I'm going to be talking about this morning. One of the most common questions that we received when we asked through a web survey providers what questions they had was, why is DHH doing this? What is the reason for the carve-in? We're going to talk about the services and the providers that are going to be impacted by the change. Talk about, at the center of it all, of course, is the members, the more than 1.1 million Medicaid members who are eligible to receive mental health and substance use treatment as part of their package. And we're going to talk about exactly what it is that will be changing on December 1st, or what has perhaps already changed. And then we want to talk about what we're doing to set providers up for success so that we can have a seamless transition. And tell you about tools that we've created, where you can find information. And so we want a continuous feedback loop, information from DHH to you, and then you are our eyes and ears on the ground. Always remember that we're inside the 4 walls of this building. At 428 North 4th Street in Baton Rouge, while you are out on the ground seeing people who are actually impacted by this change. So as we have been working toward over the past year, this is the good news when the decision was made to transition behavioral health to our Bayou Health plans. The good news is we had 12 months to do it, and that was also the bad news, is that we only had 12 months to do it. And so it has consumed our undivided attention for the last going on 10 plus months now. And so as we've thought about what our short-term goals are during this transition, and I'm defining the short term as between now and February 29th, which will be 3 months past go live. The first thing, and this one we recently added because we saw that it was an issue, is assuring the continuation, and that is both for new authorizations, people newly entering the system, and having a medical necessity for mental health and substance use treatment between now and December 1st. And then those individuals who have been receiving services, but it comes time for their annual renewal. So we want to assure that there's no disruption of services between now and December 1 to put us at the point where December 1 we're not in a deep hole that we're trying to dig out of with a big backlog. And we want to avoid any interruption in the mental health and substance use treatment services that our members wouldn't be receiving if they were not medically necessary. We know that. And so we can ill afford to see any slippage in the level of services that they're receiving. And that's about 75,000 of the 1.1 individuals who are going to be and somehow impacted by this transition, about 75,000 who are currently receiving services that we're talking about here. And then in order for those 75,000 people to receive services, they rely on the 20,000 plus specialized behavioral health providers. And so we are trying to use lessons learned from the Bayou Health implementation in February of 2012 and the Louisiana Behavioral Health Partnership implementation in March of 2012. Use those lessons learned to identify the things that we can be proactive and preemptive about. And one of those is we want to avoid, minimize disruptions in cash flow for providers. We know that's important. And then there is no denying that providers right now are, the administrative job involves one health plan. And now that is going to involve 6 health plans. Not only will you continue to deal with Magellan for a small subset of children and youth, but we now are adding the 5 Bayou health plans. And so any way that we can reduce or mitigate that associated administrative complexity, we're open to do that and want to do that. And so our ears are open for suggestions you may have and entertain ways to do that. So we were asked by providers, well, you've stated your goals, and what do you consider to be the critical elements for success, and how will you determine whether you've achieved what you wanted to, what's necessary? Number 1 is the execution of contracts and credentialing for our existing providers with the 5 Bayou health plans, and new providers who may not even be contracted. This administrative streamlining, we can't emphasize that too strongly. Sufficient participation of providers. People can't receive services if they're not providers who will offer the services. Again, we've got to minimize those disruptions in cash flow, assure that reimbursement continues at the current level that you're currently receiving, so that providers' bottom line is not adversely impacted. And communication. Two-way communication is that we provide information to providers and stakeholders and members through multiple channels, and that we have the way to receive communication from you and be able to respond rapidly to that information that we get. So a little just about the transition and what is going to be happening. To recap, Magellan, who has been the management organization for any behavioral health services in Louisiana since Medicaid since March of 2012, they will no longer provide manage those services, with the exception of just under 2,000 children and youth who were enrolled in the Coordinated Systems of Care Program, or CSOC, for dates of service. It's driven by dates of service of 12/1 and after midnight on December 1st. If you hear the term carve-in, the first thing we think when we hear carving is Thanksgiving turkeys, but it is a term that's used in Medicaid behavioral health or Medicaid managed care, that services can be carved in to the core benefits and services package or carved out. It just means included or excluded. So they have been excluded from Bayou Health and provided through Magellan, through the Behavioral Health Partnership or the statewide management organization. Now they're going to be included or carved in. Now there is a second group. We've got about 975,000 people who are receiving Bayou Health already. And we've got about 120,000 who are not receiving Bayou Health, but we're going to be putting in a Bayou Health plan, and the only thing that they're going to get from their Bayou Health plan is if they need specialized mental health or substance use treatment or non-emergency medical transportation. So for those three services only, is this 120,000 individuals that are going to be linked to a Bayou Health plan. So the terms, statewide management organization, SMO, those the acronym SMO, the term Louisiana Behavioral Health Partnership, and that acronym that we use for it are being retired for Medicaid services on or after December 1st. So it's being replaced by Bayou Health plans. It's all being folded into one. So our Bayou Health plans, that we have 5. We've got the 3 A's, Aetna, Amera Group, and Amera Healthcare TOS, Louisiana Healthcare Connections, in United Healthcare. 4 of these 5 plans have been with us for more than 4 years. Aetna we've been working with for more than a year. And so these are, as I was thinking about this last night, this transition, we're not going into the unknown. These providers are known to us. We know what they're capable of. We know their employees. The employees who work for them have knowledge and experience with mental health and substance use services in Louisiana. Many of them in their previous life worked for state government, for the Office of Behavioral Health or Medicaid. They live in Louisiana. They work in Louisiana. So we've got, between the 5 plans, we've got more than 1,000 individuals living here in Louisiana and working who will be doing the coordination and the management of services, including Bayou Health, behavioral services. And they are adding a lot of additional staff, both clinical, and operations staff to help with the management of these services.